And following that, of course, there was the announcement of the interim delivery plan for ME, and the consultation was opened up for those with a lived experience. His hand was all over that work, and that has really been transformational in terms of getting the opinions of those who are actually living with ME on a day-to-day basis. But the publication of the final plan has been delayed several times, as we've heard already. So this is something I'll press the Minister on. We need to know when the final delivery plan is going to be produced, and we don't want it to be after a general election, because another government might mean different priorities. We need that plan now. Other steps that have taken the situation forward in terms of those with ME was the publication of the new NICE guideline in 2021. And this replaced the previous guideline that had recommended graded exercise therapy as a treatment for ME, a treatment which many had undertaken, and many had had their symptoms made far worse as a result of. So it was good to see the publication of that, but there's still much more to be done. We've heard this afternoon from both the member for Putney and the member for Romsey and Southampton North that this is a condition that impacts women far more than men. So there has to be a focus on women, both in research and in terms of the treatment and diagnosis of the condition. But there's lots of issues that are experienced by people with ME. A lack of understanding in healthcare by healthcare professionals, as has been highlighted by the Honourable Member for Hayes and Harlington, which leads to delays in diagnosis and inappropriate treatments. And we are still hearing of people being forced through graded exercise, i.e. the old NICE guidelines, not the new ones. Parents of children with ME are finding themselves subject to child protection investigations. This has to stop. And of course, difficulties negotiating the welfare system, as has been highlighted by the Honourable Member from Strangford. And according to Anne Innes, who is a welfare rights advisor with the ME Association, repeated assessments are a huge strain on people with ME. They put them back considerably in terms of their health. But one of the areas of greatest concern is the treatment of those with severe ME. It's estimated that 1 in 4 people with ME have it severely, which means they're housebound or bedbound and need 24-hour care. There have been 62 deaths between 2017 and 2021 attributed to ME. And the tragic death of Maeve Boothby O'Neill highlights the need for urgent action. Maeve was hospitalised repeatedly and repeatedly discharged due to a lack of specialist services for ME patients. The absence of known treatments meant her diagnosis, sadly, came too late. And I pay tribute to her dad, Sean O'Neill, who joins us this afternoon for the work he has done. But over the next couple of months, APPG will be taking evidence from those affected by severe ME, and I'd encourage the members that are here today to join us for those sessions where we'll hear what we can do as parliamentarians and what we should be doing. But if outcomes are going to improve, increased funding for biomedical research is vital, and I would ask the Minister how much there's going to be, how that's going to be delivered and where we're going to see that. No, I'm out of time, but I just pay very quick tribute to a couple of people. Countess Marr from the other place, who sadly has had to retire, but she's done decades of work. Sonia Chowdhury from Action for ME, who joins us. Forward ME, the ME Association, and to all of those affected by ME and their families who have done so much work bringing it to the attention of members here in this place.
Minister.
Thank you very much, Dame Siobhan, and it's always a pleasure to serve under your chairmanship. Can I start by congratulating the Right Honourable Gentleman, the member for Bromsgrove, for securing this really important debate, but also for the work that he's done in the past as Health Secretary, but also continuing to do as a Member of Parliament on the issue of ME, which we know is a profoundly debilitating and chronic condition that affects various systems across the body. Figures estimate that there are at least 250,000 people in the UK living with ME. However, it's estimated that upwards of 1.3 million people are living with ME or ME-like symptoms following a COVID-19 infection. As we've heard, women are 5 times more likely to develop ME than men and experience more symptoms than men. Many parallels have been drawn between ME and long COVID, given research has indicated that at least half of those living with long COVID have symptoms that directly mirror those of ME. And Dame Siobhan, as someone who continues to suffer from the effects of long COVID, those are symptoms that are all too familiar to me. A draining fatigue that never seems to go away, constantly disturbed sleep, an endless feeling of exhaustion, and a debilitating brain fog that can strike at the most inconvenient of moments. And I just want to place on the record that this week I've managed to control my long COVID for the best part of 2 years. And this week has been a very bad week for me. I was in bed for all of today and have only come in just to do this speech today. And the reason there's a bundle of tissues here is because the sweats just hit me walking into work. So I do understand. I've lived with the experience of symptoms very similar to ME. And I have to say I agree with my right honourable friend, the member for Hayes and Harlington, about the impact this has on people in work because you don't know which days are going to be your good days and your bad days. And you are judged against your bad days, sadly. And that is true. And we need to educate employers about ME, about long COVID, so that reasonable adjustments can be made. But also when it comes to the changes to the welfare system. Because when I'm on my very worst of days, very early on after I contracted COVID-19, if I'd have turned up for a work capability assessment, I'd have been signed off work because it was obvious to all. But on my best days, you'd think there's nothing wrong with him. And so if I had the misfortune of having my work capability assessment on one of my better days, I'd be then put into work when I wasn't capable. So these are issues that cross government we've got to attend to. And we know that ME costs the UK economy around £3.3 billion a year, and that is growing. But we also need far better understanding of this debilitating condition and the impacts that it has on too many people's day-to-day lives. And that's why Labour is committed to putting Britain at the front of the queue for treatments by boosting clinical trial activity in the NHS. We'll speed up recruitment to trials and give more people the chance to participate. We will link up clinical trial registries to create national standing registries and harness the power of the NHS app to invite eligible participants to take part in research studies which they are eligible for. We also need to rebuild the system so that it recognises the impact of post-viral conditions like ME and that it equips those with the tools needed to work with it. We need to refocus our services away from hospital settings to be rooted in the community so that patients can access care when and where they need it. And we need to bolster the workforce that can understand better ME and so that people can get timely care. But above all, Dame Siobhan, and I'll end on this, we need to get that delivery plan published sooner rather than later. And I implore on the Minister, for World ME Day, he's got cross-party support. Let's get it published ASAP.
Call the Minister. Thank you, Dame Siobhan. It's a pleasure to serve under your chairmanship, and can I start by paying tribute to my right honourable friend, the member for Bromsgrove, for bringing forward such an important debate ahead of World ME Day on the 12th of May. As Health Secretary, he laid the foundations for our cross-government delivery plan, and from the backbenches, he has been a tireless champion for people living with ME. Let me join him in welcoming his cousin to the House today. I'd also like to pay tribute to the ME Association, Action for ME, Forward ME, and many other outstanding charities who do incredible work in this area. Can I also thank the Right Honourable members for Barking, Hayes and Harlington, Romsey and Southampton North, the Honourable members for Devizes, North Shropshire, Putney and Strangford, and the Shadow SNP spokeswoman and the Shadow Minister for their thoughtful contributions. And I particularly pay tribute to the Shadow SNP spokeswoman for the work she's done as part of the APPG. And can I particularly pay tribute to the Shadow Minister for coming here today despite his own health challenges. I will do my best to address as many of the points raised as possible during my response in the time that is allowed. At the start, let me just address one of the points that was made by the Right Honourable Member for Barking. This is very much a cross-government piece of work. I'll be working very closely, particularly with the Department for Education and others, to ensure that we get this right. It is correct that this is a health lead, but it is right that this is a cross-government piece of work. ME, or chronic fatigue syndrome, is a complex medical condition with a wide array of symptoms. Some people with ME struggle to do even the most basic things that we all take for granted, going to the office, seeing a GP, or even taking their children to football. This debate comes at a critical time, as new studies are beginning to pinpoint parts of the brain that affect the condition. And a recent report has shown the yearly cost to the UK economy could be above £3 billion. So whilst our understanding is improving, people with ME must receive the right care and support to manage their symptoms and, where possible, to be able to move on with their lives. But sadly, my right honourable friend has so eloquently set out today, there has been a real lack of awareness among some medical professionals and the wider public, a point also highlighted by my honourable friend, the member for Devizes, and the right honourable member for Hayes and Harlington. For so long, people were dismissed, ignored, or even told their symptoms were all in their head. But as anyone who lives with ME knows, it is so much more than just feeling very tired. For a quarter of sufferers with severe symptoms, it is truly debilitating. This is why our delivery plan is vital. As my right honourable friend knows, it has two core principles at its heart. First, we must know more about ME if we are able to improve outcomes. And second, we must trust and listen to people with ME to improve their experience. That is why the government published the interim delivery plan in August last year, proposing a set of actions on research and education, but also tackling those old attitudes and adapting the language we use to describe the condition. Since then, we have consulted on the interim delivery plan to understand where the plan is strong and where we need to go further. I would like to thank the more than 3,000 people and organisations right across the United Kingdom who took part. As we speak, officials are analysing thousands of responses, and we will publish a summary shortly. These responses will be instrumental in developing the final cross-government delivery plan, which will be published later this year. I completely understand my right honourable friend's frustrations, and he makes a powerful case for publishing the plan before the summer. Whilst I cannot make that commitment at this time, I have assured him privately, and I will do so again today publicly, that I will do all in my power to ensure that the plan is published as soon as possible. Our consultation had a huge response, which is fantastic, as we wanted the broadest range of voices to inform how we shape the plan. But the responses have also shown just how complex the challenges are. Once we've published our response to the consultation in the spring, it is vital that we go back and work very closely with patient groups to finesse the final plan, which could take some time. But as my right honourable friend has said, For too long, people with ME have been ignored and dismissed. That's why we want to take the time to properly understand the challenges they face and listen to the solutions they propose, because it is so important that we get this right. But I have heard him, and I will continue to work hard with officials to come up with a plan that delivers for people with ME as soon as possible.
The Minister could write to us about those areas that require the finessing for the eventual final plan.
So I'm happy to provide an update to members. I hope when we provide that summary of the 3,000 plus responses, it will shine a real clear light on it. But I'm more than happy to write to everyone who's engaged in today's debate to just update and perhaps address any points that I'm not able to address in the time allowed. Dame Siobhan, patients can only receive the care they deserve with timely and accurate diagnosis. Sadly, there is no specific test for ME, which can be challenging to diagnose as it shares some symptoms with other conditions as set out by the Shadow Minister. That's why the National Institute for Health and Care Excellence published the new guidelines that several members mentioned on the management of ME in 2021. This was a step forward in terms of helping medical professionals understand the condition for people to be diagnosed as soon as possible. It also set out best practice for healthcare professionals in the management of ME and the care and support they should offer to patients. However,
We've heard this afternoon that there are many health trusts that are not implementing the new guidelines. Could he or his department undertake to write to health boards to actually remind them that this the new guideline is in place?
So I completely understand the frustration which was raised by the member for North Shropshire as well as other members about the lack of implementation. At the moment, NHS England and ourselves, we are working hard to understand the barriers as to why the guidelines haven't been fully implemented. They should be fully implemented, but they haven't been, and we acknowledge that. The reason why it's so important that we get this plan over the line, because the final delivery plan will, I'm sure without doubt, underline the need to follow NICE guidelines. And this will be underpinned by e-learning from the department on the development of new medical professionals and other initiatives that have been taken as part of the plan. I'm very keen for that to be looked at. I'm just going to turn to medical training, but the NICE guidelines should be being followed, and we're trying to understand why in all too many trusts, sadly, that has not been the case. These new guidelines, of course, whilst they're important by themselves, they must come with a broader cultural shift across the NHS, which is why we've been working with NHS England to develop an e-learning course for health professionals who have helped to develop that course themselves alongside charities and people living with ME. The Medical Schools Council will promote this course to every medical school in the country, whilst encouraging schools to take students face-to-face with patients who suffer from ME to help bust some of the myths around the condition. Dame Siobhan, I would like to end by saying a few words about the future. I strongly agree with my right honourable friend on the importance of research. As he knows, the government is funding research into ME through the National Institute for Health and Care Research, the NIHR, and the Medical Research Council, the MRC. As he kindly mentioned, these institutions came together to fund Decode ME, the world's largest genome-wide association study of the condition, something also mentioned by the Honourable Member for Putney. We're backing this study with over £3 million to analyse the samples from 25,000 people in the search for genetic differences that may indicate an underlying cause or the increased risk of developing the condition. And the study is already generating key insights. For example, whilst it has long been known that women are more susceptible to the condition, the Decode ME study has shown for the first time how their experience differs from men. And I'm happy to provide my right honourable friend, the member for Romsey and Southampton North, with the assurance that not only will I do everything to get this plan over the line as quickly as possible, but I will also work with people like the Chief Scientific Advisor, Professor Lucy Chappell, to eradicate the gender bias in research. Genomics is already revolutionising the way we diagnose and treat a range of conditions, solving riddles for diseases that were mysteries just 10 years ago. And by improving understanding, investing in research and implementing our delivery plan, we will go further and faster in the years ahead. Dame Siobhan, I know there is much to do. I would end by paying tribute to my Right Honourable friend for everything he's done on this. I will continue to work with him and other Honourable and Right Honourable members to ensure we get this right.
The question is that the House has considered World ME Day. As many of that opinion say aye. Aye. To the contrary, no. I think the ayes have it. The ayes have it. Order, order.